Alright you guys, I have the amazing Dr. Albert with me, and I wanted to touch up on a subject that I've been stressing on Instagram for the past few days, because it's been something that I see a lot going on in the fitness industry, and not necessarily just in the fitness industry at the moment, but with a lot of girls that have gotten their implants done. And I wanted to talk to Dr. Albert because he's the best in the industry. He did my breast augmentation, and I'm extremely happy. I trust him 110%, and I wanted him to give you guys his professional idea on what is going on right now.
Well, first of all, good morning, and I commend you for helping women out there try to understand really what's going on and maybe some of the truth and science behind it. So breast implants have been around for a long time. They've had a lot of problems initially. The original brand of Dow Pharmaceutical breast implants were a liquid silicone. The outer capsule would rupture all the time. There was no question that the molecules of silicone are very irritating to tissue. The body can form what's called a granulomatous reaction, causes a bunch of inflammation. A lot of those patients had alleged in lawsuits against the company that they were causing cancer, that they were causing autoimmune diseases, that they were causing all kinds of problems. So women started getting their implants out. It became kind of a really panic for a lot of patients who were really concerned about problems they were having. So the FDA pulled them off the market, and that's when saline implants came out. And the outer covering of a saline implant is made out of silicone as well. And you know, they're really not the greatest implants. I mean, it's a water balloon, and a lot of women don't like the feel of them, particularly for thin, athletic women like yourself. They ripple, they look horrible, they feel horrible, they deflate over time, they're lousy. So the FDA started a study back in the year 2000 to bring back a new generation of silicone breast implants that were supposed to undergo a 10-year study, a prospective study, which means they take a group of women, and actually the categories of women were women who had either had breast cancer and required reconstruction, women who had previous silicone breast implants and were having issues, women who were having, for whatever reason, consistent problems with saline breast implants, or women that were requiring breast lift or basically a reconstructive procedure of the chest wall. And I think out of the whole group of those four group of study patients, the one that I found the most interesting was really the fact that they were doing it for reconstruction patients who had cancer. If you think about a cancer patient, I mean, talk about an assault on the immune system, right? They're on immunosuppressive drugs, they're on anti-estrogen drugs, they've had maybe surgery, radiation, chemotherapy. I mean, they've been under, their body's been under attack to try to destroy cancer. And yet, they took those women starting in 2000. That was part of the study, a multi-center study throughout the United States. It was supposed to go to 2010, and it stopped in 2007 because all the data that was coming back, as we were diligently following patients to make sure that they weren't causing these problems, that we weren't seeing these problems with patients, came back and unanimously was supporting the fact that these implants were safe. Okay, so the silicone came back onto the market. Now, there is no question that right now there is a movement of patients that is really starting again to be concerned that breast implants are causing a whole host of really all the same concerns that were generated with the first generation of implants in the 80s. What have you heard about that?
So I've heard after a year and a half, 2 years, they start feeling fatigue. Not necessarily any feeling in the breast specifically, they just feel physically, they feel sick. They get, I guess they look tired all the time. They have bags under their eyes, which I feel like that's something day to day. I mean, we're all stressed out, we all work, we all, we're tired. They get fogginess, what else, depression, I don't know, just so many things that pretty much make them feel that it could be the implant. And when I say it, even when I say it out loud, it doesn't make sense to me. That's why I wanted him to explain, because also I'm not as educated as a professional, obviously, and I just don't understand how these type of causes or, you know, behaviors have to do with an implant? Like, how does that...
Well, look, okay, I'm a science-based person, okay? If I haven't seen it in a paper, if I haven't seen a study done, it's difficult for me to kind of put weight towards anything that hasn't been studied. And a study, as y'all know, usually has what's called a control group. It has a group of patients that don't receive treatment. In other words, you have a group of women that maybe have breast implants and are having problems. You have a group of women who want them out, they get them out, and you compare over time as to whether or not these two people do better. There's also what's called a placebo group. You tell them you take the implants out, and you really don't.
Yes.
Now, I don't know of any woman that might consent to that procedure. Plus, usually it's pretty obvious if you've taken someone's breast implants out. They notice the difference. So it's sort of a difficult study to do. That would probably definitively show, is there really a cause and effect relationship between what they believe is going on with their bodies and maybe the true, yes, I have breast implants, true, I'm having a whole host of constitutional symptoms and depression and anxiety and fatigue and malaise and muscle aches and GI problems and weight gain or weight loss or all these things that are certainly out there. But is it unrelated? Is it an unrelated condition? So, you know, recently, and I shared this with you before you had surgery, we are now aware of actually a very small group of patients. When I say small, 3. I've got 3 documented cases, which, by the way, does not make a good study, and certainly you should not rely upon this information as I present it to you as to make a decision for yourself. Maybe when I get about 100 patients I've done this for, I'll be able to, you know, properly present the literature and run statistics to know that it's legitimate or not. But we've identified a couple of women who have actually tested positive, working with an immunologist, for an allergy to the outer core of the implant. And you know, it's indisputable, right? We've done a skin test. We've removed the implants for the patient. We've tested the capsule of the scar tissue around it, and sure enough, it is. Yeah. But those patients, all again, 3 patients, okay, really not clinically significant yet. All 3 patients were hyperallergenic patients. They were allergic to almost all kinds of food groups. You couldn't put a Band-Aid on them without them breaking out in a rash. You know, detergents. All kinds of anything on their skin they were having problems with. I have a feeling that when we eventually get this done over the next couple of years and look at it, we're going to find this is a very, very small subset of the population. Breast implants have to be, for females, the most common cosmetic procedure performed today, next to liposuction. And so it's very common. Is there potentially a problem? Maybe is the answer. I have a feeling, though, that to properly, rather than saying, okay, it's got to be my breast implants, the best thing to do is get to your physician that maybe did the surgery. Have them do an examination on you. See whether or not there's something going on. Is the implant hard? Is there a rash? Is the skin irregular? Is there pain and sensitivity? Maybe get some breast imaging studies, maybe an ultrasound, maybe a mammogram is indicated, maybe some lab work is indicated, maybe you're hypothyroid and you don't know it, maybe you've got hormonal imbalances and don't know it, or like you've suggested, maybe just the daily stressors and the mind-body connection are burning you out, and true, you've got breast implants, true, you've got a lot of issues going on that are real, they're affecting you.
Yeah.
But they might be unrelated. And my advice to my patients, and again, all 3 patients and other patients that have come to me with these concerns, is that, look, I cannot and would not advocate removing your breast implants as a cure for these problems. In fact, I know there's a group of physicians out there that do say, hey, sure, I'll do it for you. And they don't properly counsel their patients to say, look, there is not one shred of science right now that says I'm going to help you. And you say, well, what's the big deal? You know, you're going to take out my breast implants. It's a surgery. It's an operation. It's an operation that can have complications. It can cause an infection. It requires antibiotics. It requires a recovery. It's not an innocuous thing, and there's inherent risk to those things. And so rather than putting yourself through an operation that carries risk, which I don't take lightly. I mean, every time I operate on this, I say, would I do this to my own family member? If I wouldn't do it to you, I wouldn't do it to my daughter, I wouldn't do it to you, or I wouldn't do it to my wife. Is that the right course of action? And making informed decisions, as opposed to maybe making an emotional decision about things, I think is the best way to go, in my professional opinion.
Yeah.
What questions do you think women might have out there that I can answer?
I think on what material, what it's made out of. I've had a girl message me about her doing research on this issue specifically, and she said that she found mostly silicone implants that are the ones that give those type of issues, and the gummy bears are the ones that work better. So, and I know we went through this because you actually explained to me the difference between silicone and gummy bears and why gummy bears are better.
Well, I'm happy to briefly talk about that. So remember, whether or not it's a saline implant or a silicone implant, both the outer covering is made out of silicone. Okay, the polymers are actually different. Okay, meaning it's a different chemical compound makeup of silicone, but either way it's silicone. Obviously, a saline implant is full of sterile saline, salt water. A woman's body is 60% sterile saline anyway, right? But the inside is what's called a cohesive gel. It's no longer a liquid silicone like the old implants. And if you were to cut the implant in half, I'm grabbing this little picture here, you can kind of show the crowd up there. If you cut the implant in half, the gummy bear refers to the fact that the inside of it is not a liquid, it's like a gelatin, or we call it cohesive gel, or the vernacular today is gummy bear, okay? It just means that if the implant is punctured, it's not going to leak liquid silicone everywhere. There is still no question that exposed silicone to the inside of the body will create an inflammatory response, no question. I've been placing these implants, these particular type of implants, granted there's been different styles of these implants, but the same breakdown of these, since the year 2000. I have never seen one spontaneously rupture. Okay, spontaneous meaning it happened by itself. The implant device somehow broke. All right, I've seen car accidents, seatbelt injuries have crushed the implant. I've seen more commonly where women have had maybe breast biopsies, and during a needle localization biopsy, they puncture the implant. The implant has to be removed. I had one patient who had went very aggressively with her breast pump and actually damaged the outer covering of an implant. Yeah. But other than that, I've never seen them spontaneously break down and cause a problem, which means that the inside of the implant is not exposed to the rest of the body. Now, again, is it possible that some patients hyperreact to this compound? Sure. Yeah. I mean, look, again, you read the backside of a Tylenol bottle, and it tells you that, too much Tylenol can cause liver failure, right? Yeah. Everything, whether or not you take glutamine in excess, you can cause renal failure if you take too much glutamine every day, right? Yeah. Aspirin can burn a hole through your stomach. I mean, take too much of anything, it's bad. I think, though, the research does support that they are safe, okay? Maybe that'll change over the next 10 years, okay? But I think when you have people message you, and because you're so well respected in the fitness community, because you're so good at communicating with patients and people look to you for answers, which all of you out there should be appreciative that you get somebody who spends this kind of time like Carmen to help not educate just women about fitness and her journey, but also about health, women's health. It's a pretty good resource to have out there, and you should be appreciative to have Carmen out there for you. Please don't make an emotional decision without getting a proper workout, discussing it with your primary care doctor, discussing it with your surgeon or another surgeon, and really making an informed decision. I do have one patient who came to me with all the concerns you've talked about, and I had her list all of the problems that she was having, and none of them really could be attributed to one specific disease, okay? And she really wanted her breast implants out, and we went through the same discussion, and we got her tested, we found out about things, and she's had the surgery, and she says today that she feels better. But I've asked her specifically, well, like what is better? And that's where it kind of gets a little gray for her in saying, well, you know, all these symptoms I've had have completely gone. She says things have improved. That to me, you know, says, well, maybe that did help her, right? Maybe emotionally it helped her. But it's not as though all of her symptoms have gone away, and it's not like this was a magic wand for her.
Yeah.
And that's, I think, first do no harm, right? It's the Hippocratic Oath. It's a little bit, you know, out there that maybe doctors don't practice medicine like that, but I don't like doing operations on people unless I know I can help them. If I have a patient, because this is elective, and you say, take out my breast implants, I want them out, and you sign informed consent, I'll do it for you. If you came in and said, chop off my leg below the knee, because I really don't want this leg anymore, it's annoying me, please, I want to hop, call me, you know, I want to hop, you know, that's me. I think hopping is cool, hopping is in, chop off my leg, you can pay me enough, right, to chop your leg off, okay? I think that do what's right and do what's informed and make that decision slowly and carefully, and then, you know, hopefully you get better, but I just couldn't promise that.
Yeah.
What other things have people brought up to you that were questions you might have?
You touched up on the silicone part with the allergy, hypoallergenic. I did advise them on Instagram, for example, I was like, make sure your doctor cares about your health, because I think it's a, you know, it's not such a huge operation, but it is, and you're making a physical change that will change your life. Like, it changed my entire life. You know, and would you advise women that are hypoallergenic maybe to not get them done? Because
I would say if I had a patient that came in and said, I'm allergic to everything, I have skin allergies, all these things. Again, I work with a immunologist by the name of Dr. Jorgensen, a board-certified immunologist, which means, by the way, went to medical school, did an internal medicine residency, and then did a fellowship in immunology. Just FYI, guys, that's about 7 or 8 years after medical school. So he's a smart guy, and we scientifically approach this. Okay, my concern is there's going to be a bunch of copycat tests that go out on there by, well, frankly, people that may not have his credentials, attention to detail on things, that they're going to, you know, just start waving wands and saying, yeah, you're allergic to, you shouldn't do it. Yeah. Be cautious of that. Go to somebody with credentials like that is going to approach this as they would any other disease. If they were going to diagnose diabetes or high blood pressure or glaucoma, they're going to take a measurable test to know consistently that this is the problem, and then know how to manage it and see that it's getting better. I would say, if you're really concerned, am I potentially a risk? The skin test is easy to do.
Yeah.
Do it. Then you'll know up front, you can make that decision. If you're having problems, get the skin test. We can help you coordinate that. Do that first before maybe running for the knife.
Yeah.
You know, because here's one thing, you know, again, for this patient, she was very large. She had a lot of breast tissue. And you take an implant out, you know, a breast implant is a tissue expander. It's going to grow and stretch skin. And where do you think all that skin goes?
Yeah, that must not be a good look after.
It's tough, you know, and you lose that volume. For an older patient in particular, that skin's not going to shrink back up. I had a patient who, and actually a fourth patient I forgot to mention, that I treated in Austin recently, and she has legitimate autoimmune disease. Multiple problems. She's a very young lady. She's got Crohn's and colitis and a bunch of other issues. Just every time she has a surgery, it's a big deal. And she was, you know, a mom, had a couple of kids. She's a small, thin, athletic woman. She's actually a trainer. And she said, I just want them out. Just get them out. And I told her, I said, you're going to have a deformity if we just take these out. And so she didn't just get the quick make an incision, pull it out. We had to do a breast lift. That's incisions around nipples, moving nipples up. It's scars on the chest wall, because otherwise she literally would have been deformed, because as this implant had stretched her skin, there was no way it was going to go back. And my fear is, that if a person is approaching a procedure because of an emotional decision, my boyfriend left me because of my concerns of all my medical problems, or I don't feel good about myself, or I'm having problems at work, or whatever, and then you have something else done to you. You just add to your plate, right? Sometimes that can push people completely in the wrong direction, right? That part you got to be really careful about. Make informed decisions, do things carefully. It's not an emergency operation unless you got an infection. So do your research, interview more than one doctor, get labs, get a physical exam, maybe get a skin test, but don't jump to it. And then those that are out there in the social media world telling you all the symptoms that they're having, and all the things, and I'm not saying trying to convince you, okay, but their argument is convincing. You don't know that person. You're not their doctor. You're not looking at their medical charts. You're not, be careful about what you read as a reason for you personally to jump into something that is a risk.
Yeah, we get influenced so easily by these influencers, and I feel like it's a placebo most of the time. And girls specifically take decisions. Women tend to take emotional decisions. So yeah, I honestly wanted to see Dr. Albert today and tell you guys to stay informed, because I can preach to you guys all the time this, but you won't listen to me. So, it's just be informed, be smart, ask questions, I'm sure you guys have friends that have gotten their boobs done with other doctors. Go see them, touch them, feel them, ask them questions. Be smart about it. When I made my decision, I have seen his work on a lot of my competitor friends, and I wanted to work with Dr. Albert because I knew what he knows, and he's a professional. And when I had a consult with you and Kevin, even Kevin was like, oh my god, like, this guy is awesome, like, he can answer every question and he's so informed. That's the type of doctor that you want to go to, that cares about your health, not just to make money, So,
well, I appreciate your kind words.
I definitely appreciate you for sure. Yeah,
I do. Again, my wife and I, we consider it a privilege to do what we do. Let's let her write, and we consider it an awesome responsibility to take, an otherwise incredibly healthy person, put him to sleep, and do a procedure that carries risk.
Yeah.
And really, also what matters, besides my side of the table, what also matters is what you did as a patient. You were the perfect patient. Okay, your discipline in the gym translated into being the perfect patient. Follow your doctor's recommendations. Don't improvise. They tell you to take the antibiotics. Take the antibiotics. Don't go off and go to Dr. Google and learn from Dr. Google. I've been doing this for 20 years, and I'm pretty sure I know more than Dr. Google.
Yeah.
And really take it seriously. It's not apples to apples. Breast implants are breast implants, but not every practice approaches it from a holistic perspective and like taking care of the whole patient as opposed to like this little specific area of the body. So, well, anytime I can be a resource, you just let me know. I'm here for you. But again, thank you for all you do for women out there. You're a women's advocate, and being a father of 2 daughters, I like that a lot. I respect
She has
that a lot.
some beautiful daughters.
Yeah, God help me.
Oh my God, they're so pretty. Thank you so much, doctor.
Okay.
I appreciate your.
You're welcome.
Yeah.
You're welcome. All right, I'm going.
Alright, you guys. So I hope this convo helps you decide what you want to do with your body and your life, and it helps you realize that it's cool and all to have influencers and stuff, but don't take a decision based off placebo, or don't take a decision based off what the girl on Instagram that you follow says. Make a decision based off what you want, what your lifestyle requires, and a smart decision for yourself. I simply just wanted to tackle this subject because I see it as a trend on social media, and it's kind of crazy to me because there's not really a study Woo. Boom. I was waiting for the camera to work. There's not really a study that says specifically like, okay, your symptoms are from your breast implants. So be aware of that. Again, do your research. And just be smart. I hope this was informative. I hope this was informative for you ladies, and it helps you decide what you want to do. This was a huge step in my life, and I'm extremely happy with my decision and the doctor that I chose. So yeah, if you are in Arizona, you want to go to Dr. Albert, because he is the best.